Welcome. NSG 515, Study Section 6. Structural layout of intensive care units and emergency team. Introduction. In this study section, you will be looking at the structures of an intensive care unit. You will explain the emergency team as well. In addition, you will highlight the different categories of organ system. Finally, you will be explaining how an intensive care unit should look like. Learning outcomes. When you have studied this section, you should be able to describe intensive care units. Intensive care units. As we have discussed in study section 1, intensive care units ICU are specialist hospital wards. They provide intensive care, treatment and monitoring for people in a critically ill or unstable condition. Medical emergency team, MET, is a team usually consisting of a group of physicians, anesthetics, and senior nurses that can be summoned urgently to attend to patients with deteriorating medical conditions. Dictionary of Nursing, 2008. Structural layout of intensive care units. Intensive care unit is a unit of the hospital in which patients with acute life-threatening illness or injury are cared for. It can therefore be deduced that structural layout refers to the way parts of a system are arranged in relation to one another. Microsoft Encounter, 2009. Sitting. For clinical reasons, the intensive care unit should be easily accessible to the department from which patients are usually admitted, such as the accident and emergency departments, recovery room, surgical and medical wards, Department of Health and Social Security, DHSS 2008. Those hospitals which receive or transfer patients to and fro specialist units in other hospitals or who receive frequent transfers from outside the hospital must consider the position of the ICU in relation to ambulance or helicopter access. Size of ICU. For efficient management, an intensive care unit should not exceed 8 beds or at the very most 10, and that the minimum number should be 4. If more than 10 beds are required, then another unit should be opened. Patients area. The British Medical Association recommendation is for 200 to 300 feet, 18.9 to 28.4 meters square per bed in the open areas, and the DHSS, Department of Health and Social Security, DHSS 2008, recommends 195 feet, 18.5 meters square. This size needs to include a space of about 1.0 meter between the head of the bed and the wall, as well as a similar space at the foot of the bed. The minimum distance between bed centers should be 11 feet 6 in 3.6 meter in the open area. The unit should be fully air conditioned, although windows should be openable when the system is non-operational. The patient's area should contain an open area for several beds together, plus at least 1 cubicle. Thereafter, a minimum ratio of 1 cubicle, 6 bed spaces is required. Station. Decentralized nursing stations. Multiple mini stations across units. Distribution patterns vary. Pros cons of decentralized nursing station. Feasibility of patients at all times. Increased proximity to patients. For families, nurses are close to patients or easy to. Adequate space for technology. COWs, laptops. Reduces noise levels. Bolenga in HFM 2006. Minimizes distractions and interruptions. Can increase proximity to medication rooms, supplies, etc. Increased workspace per nurse. Study section summary. In this study section, you learned that intensive care units, specialist hospital wards, they provide intensive care, treatment and monitoring for people in a critically ill or unstable condition. Medical emergency team, MET is a team, usually consisting of a group of physicians, anesthetics, and senior nurses that can be summoned urgently to attend to patients with deteriorating medical conditions. End of study section 6. Thank you.